In the world we live in today, terrorist attacks and natural disasters are unfortunately not only a threat, but a harsh reality that we have been forced to deal with.
9/11 created a very different environment for our country. What we recognized was that the capacity to lead through those sorts of unprecedented events was absolutely critical. Those people who had the self-discipline and self-control to be able to lead in truly frightening and very, very difficult situations, there's something unique and special about them, and the word meta leadership came up.
If you look at the response to Hurricane Katrina, and who was essential to the public health aspects of that response, government was important. But business was essential. Many businesses were there delivering water and critical supplies. They were able to tell us what was going on the ground around their businesses when we didn't know, when we didn't have a view into that. This is what meta leadership is about, building those connections.
To help build these connections among business, government, and nonprofit leaders, the Centers for Disease Control and Prevention and the CDC Foundation partnered with faculty from Harvard University to create the Meta Leadership Summits.
One of the biggest advantages of the Meta Leadership Summits is it brings together different people from different organizations and very, very different specialties, and who think about leadership in a very different plane.
You're continually learning. You begin with a certain set of assumptions based on what you know at the time. You change the plan, you change your response as you get more facts.
This is absolutely vital for everyone who's involved in public health and emergency preparedness to get involved with.
The CDC Foundation, the Centers for Disease Control and Prevention, the Robert Wood Johnson Foundation, and the Harvard School of Public Health are spearheading this effort.
What's unique about meta leadership is it encourages people to understand the other sectors and understand what they can bring to the table and to reach out and work with them to solve problems.
That, number one, is going to solve.
And what we realize now is that in order for our country to go to the next level of being prepared, we need this kind of leadership all across the country, in every state, in cities, in counties, so that if disaster hits, we have meta leaders who can form a network all across the country. And that's why we're supporting this, so that there will be this transformative workforce of leaders that can help us all save lives if there's a disaster.
Meta leadership really has applications far beyond emergency preparedness and response. It certainly is relevant to the work of public health.
The kinds of problems that we face as a society today aren't just crisis problems of an urgent threat nature. Whether we're talking about the obesity problem in our children, or climate change in our world, or energy crisis, these situations also require people to come together and solve problems across a whole dimension of expertise.
Most of you who work in organizations are used to Gantt charts where you...
Summit leaders insist that bringing people physically together is one of the strongest components of the event.
I think when you take 150 people from a particular area that are dealing with preparedness and response problems, and you put them in the room, they come together and they have an understanding that although they come from very, very different backgrounds and they actually have very, very different mission statements, they're all there to do the same thing. The human dimension of putting people together in a room far exceeds anything that we could probably teach them.